Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Alzheimer's disease poses a multitude of challenges, deteriorating memory, disorientation, and a steady decline in the ability to manage everyday activities. As the condition progresses, even basic self-care habits, such as maintaining oral cleanliness, can be compromised. This often results in neglected gum health, paving the way for periodontal disease and other complications that may further impact the individual's overall health and comfort. While these oral concerns are frequently underestimated, they can become an added source of discomfort and distress. In this context, periodontal care transcends routine dental maintenance and becomes a vital element of empathetic and holistic support. This session aims to equip both patients and their caregivers with the awareness and practical skills needed to safeguard gum health, helping reduce avoidable pain and enhance quality of life. With the right knowledge and attention, oral care can become a meaningful part of the caregiving journey. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today we turn our attention to an often neglected yet profoundly important aspect of healthcare, periodontal care in individuals living with Alzheimer's disease. And to help us navigate this critical intersection of cognitive decline and oral hygiene, we are honored to be joined by the distinguished dental expert, Dr. C.S. Beju. Dr. C.S. Beju is a highly respected periodontist and a distinguished academician with over 2 decades of expertise in dental education, research, and clinical practice. Currently serving as professor and head of the Department of Periodontology at Sudharastoki College of Dental Sciences and Research, Sir has played a pivotal role in shaping future dental professionals through his leadership and mentorship. An examiner for both undergraduate and postgraduate programs in periodontics across various universities in India. Sir is also actively involved in academic curriculum development and quality assurance in dental education. His commitment to excellence extends beyond academia. He has been the past president of the ISP study group, Delhi NCR, where he leads collaborative initiatives to advance periodontal science and practice. During his tenure, Sir received the Best Study Group Award twice, a testament to his leadership and vision. Notably, under his guidance, a landmark collaboration was established with the Army Dental Center, R&R, in 2024, initiating postgraduate programs in periodontology for the first time. These achievements reflect his unwavering dedication to enriching the academic landscape and strengthening institutional partnerships in the field. Sir's contributions to the field include organizing major conventions like PerioConnect, participating in research related to antimicrobial therapies in periodontics, and mentoring candidates for international dental qualifications. With a professional demeanor, strong ethical standards, and relentless drive to elevate dental education, Dr. Beju is a trusted figure in the Indian dental community, known for his academic rigor, visionary leadership, and unwavering dedication to the advancement of periodontology. Dr. C.S. Beju, THIP Media welcomes you, sir.
Pleasure here to be part of this THPI, what you're doing. Thanks for calling me for this session.
Thank you so much for your time today, sir. While periodontal care for patients with Alzheimer's, is often overlooked or it's underestimated. So, it is crucial to recognize that maintaining gum health is just as important as caring, for our overall well-being. So, with that in mind, I'd like to begin this conversation with the most fundamental question that what are the common oral and gum problems, experienced by individuals who have been diagnosed with Alzheimer's?
Uh, the content of your topic today, since it is Alzheimer's, most of the periodontal diseases, which is now in the world focus, is rated as most prevalent one among the oral health diseases. Now,
Right, sir.
considering that fact, Alzheimer's is one disease where there is a lot of cognitive disorder, where the patient
Right,
cannot maintain the daily routine oral hygiene measures. So
right, sir.
in that context, most of the people who are visiting our clinics with these kind of illness has a lot of poor oral hygiene picture when they come to us for the first time. So
Right,
I
sir.
the basic requirement for these patients is to look at their oral hygiene protocol in a better way.
G, G, sir. G. And would you say that these oral problems, impact their overall health, nutrition, and even quality of life in such patients?
Yes, it does. Because,
Okay.
in a normal patient, when we see the periodontal diseases in our daily routine practice,
Right,
most
sir.
of the time, the prevalent thing which is coming to us is a more pronounced gum disease with
Right,
a lot of bleeding. When some cases, while they speak, also the gums bleed. So
right,
in certain kind of cases where the patient's confidence also goes into a lower level, and
right,
thick amount of oral deposits in the form of calculus and tartar gives another cosmetic appearance in the routine cases. But here
right,
we are talking about the people who can't control by themselves. So
right.
definitely, I think as a dentist, as a medico, as a caregiver, I think it needs more attention in this kind of patients.
Right, right, sir. And like you just mentioned, that patients with Alzheimer's, they're dealing with a lot of cognitive issues, memory-related issues, right, sir? So they must be on some sort of medication, I suppose. They must have been prescribed with some form of
Yeah,
medication.
yeah.
So as a caregiver and as a periosurgeon yourself, you would believe that is there an impact of commonly prescribed medication for Alzheimer's disease on the patient's periodontal condition?
Yeah, I think I'm not well versed with the drugs which are used in these kind of diseases, but what I
Right, sir.
presume is, in certain cases, antipsychotic drugs, and I think cholinesterase is also used much in these kind of patients, which will in turn have an effect on the oral health.
Right.
Mainly in the picture which we get is severe xerostomia, that is a
Okay.
decreased saliva production in the mouth. Once
Right.
there is decreased saliva production in the mouth, which we call it as xerostomia, that then lead to a lot of dental caries and mucosal problems in the oral cavity. So
Right.
patient will be able to maintain their proper oral hygiene with severe xerostomia associated with these drugs.
Right. Right, sir. And now I'm going to come on to something which, relates with their daily routine. That why would you say is it, especially important to manage oral health problems proactively in such patients? And what consequences would you believe, can arise from neglecting oral care in this particular population?
So in this kind of cognitive disorders where patient is not able to perform their routine oral hygiene measures, the first thing which they will land up is your superficial gum infection in a layman's term. In a professional
Okay.
term, we call it as gingivitis. That is the
Okay.
first sign of any gum disease, wherein the patient will get a lot of bleeding even in the mildest provocation of the gums. What I
Right.
used to say is even by touching the brush on the gums, the patient will start bleeding. That
Okay.
we call it as the first stage of gum disease, otherwise known as gingivitis. Now, at
Right.
that level, if you leave the patient as it is without any help for them professionally, eventually the patient will go into the next stage of the disease, which is called as periodontitis.
Right, sir.
Once the patient is into that stage of disease, then it is difficult to save his teeth. Uh, with going on cognitive difficulties, it is not easy for the patient and for us as caregivers to take care of that particular scenario.
Yeah. Right, sir. Right. And these patients, they require a lot of support, familiar support and emotional support. So it must be a little difficult for them to, keep taking care of themselves. So I'm going to ask that, can their caregivers help, detect this particular oral discomfort or gum disease in Alzheimer's, who are, because it'll be difficult for them and they might be struggling to articulate their symptoms together, like you just mentioned.
Yeah, as a dental assistant, if you're talking about, if you make
Yes,
a
sir.
dental assistant as a caregiver for this particular patients, that would be the best thing to do. As a
Right.
medical caregiver may not be aware of the oral health needs of the patient. In that
Right.
context, I think a caregiver should be taught first what are the things to look for, firstly.
Right.
Secondly, what are the things to be maintained in that particular patient and how.
Right, sir.
Particularly, the different methods of oral hygiene protocol has to be explained to the caregiver, give a
Right, sir.
training on study models, and then we can take them up to the patient level. I think that is the
Right.
best thing to do.
Yes, sir. And like you just mentioned that, the dental support would be the best, and a peri-surgeon like yourself would be an excellent choice for helping the caregivers in such cases. So what dental care routines and professional treatment options would you suggest are most effective for maintaining oral health in such patients?
Yeah, that's a very practical question what you asked. For a
Yes.
patient who is unable to maintain their daily routine, what the first thing in our treatment plan is to look at their diagnosis. Once they are diagnosed with any of these gum problems, whether it is gingivitis or it is periodontitis, the first thing is to start with a daily routine of plaque control.
Right, sir.
The severe deposits of calculus and plaque on the teeth surfaces, which is a causative agent for this gingival and periodontal diseases. Now, since patient is unable to maintain the proper oral hygiene, the first thing should be to regain the periodontal or the oral health by a simple oral health measures by toothbrushing. Now,
Right, sir.
since they are already going through the cognitive disorder, patient may not be able to adjust well even to the simplest form of toothbrushing.
Gee.
So in that case, I think in most of the patients would be comfortable by the caregiver by using an automated toothbrush also,
Gee.
depending on the severity of the cognitive disorder.
Gee.
Once we achieve the initial stages of oral health, then we can look into other problems like cavities, dental caries, other periodontal problems that can be, dealt later.
So, like you just mentioned, sir, that prevention can play an important role, in progression of this advanced gum disease, right? So, what would you say that the role, or let's put it this way, that what role do routine dental visits and professional cleanings would play, in preventing the progression of periodontal disease in patients with Alzheimer's?
Yeah, I got it now. Basically, the preventive health checkup with the dentist once in a while, at least minimum once in 6 months, as per the literature says, is very
Right.
important in case of
Ji.
all the patients, irrespective whether the patient is having a disorder like what we are talking about or otherwise also.
Ji.
The advantage of having a routine dental health checkup for these people are basically to catch the problem in the initial stages. Now,
Right.
if you can catch a patient with this cognitive disorder at the initial gingival disease status, that will not progress further into the deeper tissues. So the
Right.
treatment also will be minimal, and the frequent visits to the dentist also will be minimal if we can catch these problems in the initial stage. So I
Ji.
think frequent dental checkup and visits are very, very important in case of both the sides, for a normal patient as well as for patient with cognitive disorders.
Okay, right. And because these patients would be in touch, with their psychiatrists first, right? So, do you believe that a good collaboration between the dentists, let's say their physicians or psychiatrists, and caregivers, along with healthy diet and lifestyle choices, improve oral health in patients with Alzheimer's?
Yeah, I do agree to that. But Dr. Saluja, unfortunately, in our country, I think there is no platform which is very active to get all these three together.
Ji.
For example, the diabetes mellitus is one of the most common finding in India, which is
Ji.
again associated with periodontal diseases.
Ji.
Though we are working in hand with the Diabetic Association of India, but there is no platform so far which has been created where a caregiver, a dentist, and a diabetologist, or here in case the psychiatrist or the psychologist all together can discuss a case. If that comes into practice, yes, I think that should be the future.
Okay, right, sir. So I think you've just mentioned that we do not have a common platform where we can, put in, a team, a multidisciplinary team to plan out a holistic care for any particular patient whatsoever. But do you believe that educating such individuals, let's say in context with educating patients with Alzheimer's about oral hygiene, such issues can be addressed?
Yeah, but then education, what you mean is to use an education tools for the patient to make them understand what is the importance. That again
Ji.
depends on the degree of cognitive deficiency. It may not be same in
Right,
all the patients, but
right,
definitely a caregiver who is dealing with the patient in a day-to-day practice will be the
right.
person in focus here. So
Okay,
as we discussed in the initial questions of this interview, I think the first and foremost team to deal with this is a caregiver education from both the
right,
sides, from the medical
right.
side as well as from the dental side.
Okay, right.
Once we achieve that, I think then things will not be that difficult.
Okay. And what practical strategies you would suggest, or you would you could tell the caregivers to ensure consistent and effective daily oral hygiene for Alzheimer's patients?
See, you can chart out a comprehensive oral health regime for a particular patient depending on
Right,
his or her disability. If the
right.
patient is well responding to your commands and he's able to understand the oral hygiene measures, I think the problem is not that difficult.
Okay,
We can easily educate the patient on models. How do you brush and what is the
right,
frequency of brushing and correct toothbrushing techniques and usage of mouthwashes to prevent the accumulation of bacteria. Because this particular disease literature has proven enough that there is a
right,
particular diversity of microbial flora which is
right,
existing in Alzheimer's patients. So the first and foremost is to educate the caregivers in that context, then educate them for the importance of professional skilling
okay,
before taking the patient to a dentist. And the patient, because of the lack in cognitive understanding, one should be able to explain what is the procedure going to be done in the dental clinic. So these kind of things are more important in dealing with these kind of patients.
right, right, sir. So I am just going to summarize this wonderful session with one final question, sir, that just help us outline a comprehensive oral health checklist, that periodontal surgeons as yourself would recommend for patients who are, diagnosed with Alzheimer's disease, just to ensure optimal oral care.
The first thing which I would put on the top of the list is the proper brushing technique. One.
Ji.
Secondly, the tongue cleaning measures, which are
Okay.
proven in the literature. The coating on the tongue because of the inability of the patient manually to use the toothbrush. The
Right,
accumulation of the bacteria on the surfaces of the tongue creates a lot of issues. So
Ji.
brushing, tongue cleaning, and then mouth rinsing.
Right,
Usage of any antibacterial mouth rinses, which help in a long way for prevention of diseases. Secondly, the foremost thing which has to be taken care here is xerostomia.
okay.
Because of the drugs which are given to the patients, xerostomia is the most common finding which we see in our clinics. So in order
Right,
to fight xerostomia, we have to give them sometimes an artificial saliva, which would
right,
lubricate their oral mucosa so that the cavity formation, dental caries, and gum diseases can be under check. So
right,
these few numbers of comprehensive dental care every 6 months with a checkup, I
right.
think we're reaching somewhere soon.
Right, right, Sam. So at home oral care regimen, management of xerostomia, and being in touch with your oral care specialist
Yes.
or your dentist is a must here.
Yes.
How wonderfully put, sir. So on that beautiful note, I really appreciate your presence with us today, sir, and I'm hoping that the insightful information shared, it would be of great value to all of them who are fighting with Alzheimer's. So thank you so much for joining
Thank
us
you so
today.
much, Dr. Saluja. All the best for your future endeavors. Thank you so much for inviting me.